Our National Demographic Health Survey as of 2018 indicated that a significant number of unmarried adolescents have more access to family planning compared to the married couples. Yes, this is very true because there are several reasons involved. You know, most of our married people, when you look at decision making, they don't have the power to make decisions. Most decisions are either determined by their partners, husbands, sometimes by family members before they are allowed to access. So the number of children is mainly determined by families and couples and partners. So that is a big deterrent also to a woman or a young adolescent, young married woman to take a unilateral decision to access family planning commodities. And this is a barrier, and part of what we do is to continue to promote that so that they will be able to make independent decisions. So even the unmarried adolescent girls that do have access, they are yet to meet the demand. We are yet to meet the demand. So there is a huge gap of unmet needs. The unmet need still by the same NDHS of 2018 indicated that almost 20% of Nigerian women and young adolescents do not have access to family planning commodities. And this applies significantly also to the unmarried young adolescents and young people that do not have access, because most of them resort to buying, on the counter in the chemist or in the pharmaceuticals. So it has to do with purchasing power, and a majority of them we also know do not have jobs, so they cannot even afford to buy family planning commodities, which is expected to be provided free. The government of Nigeria provides free family planning commodities at our health facilities at no cost, but mainly at public health facilities. So you can see this can also continue to create a barrier in terms of access. But the major challenge we have, especially for the young unmarried people and adolescents, is that anytime they attempt to access services for contraceptive commodities, there is fear, there is anxiety, which is mainly due to cultural issues, and then most of our healthcare providers are in most cases judgmental. So it kind of creates a stigma and discrimination, and then the young people do not feel comfortable accessing those services within public health facilities. So they resort to buying on the counter at the chemist or private or public or pharmaceuticals. So this is totally wrong. It violates our standards of practice. It violates the policies and the guidelines developed by the federal government to improve access to family planning commodities.